Hi there, I'm Joel and this is Nursing Tutorials with Joel. In today's tutorial, I'll be talking about a disease condition that affects the heart. It's called Angina Pectoris. We all know that the heart needs oxygen supply. It has its own blood supply, which originates from the coronary arteries. Just like every other part of the body, the heart also needs its own supplies. Now, when there is a reduction in the oxygen supply, or we say the blood supply to the heart, you have some issues that develop, and one of them is angina pectoris. The other one is myocardial infarction, but that's at a later stage. So, what is angina pectoris? It's a disease condition characterized by chest pain. There's a chest pain which is due to decreased oxygen supply to the myocardium, or we say to the heart muscle. Now, another thing about angina pectoris is that there is an imbalance between oxygen supply to the heart and oxygen demanded by the heart muscle. What are the causes? Atherosclerosis. Atherosclerosis, as you know, is the fat deposition at the coronary arteries or branches of the coronary arteries when fat droplets, cholesterol deposits over time at the coronary arteries. Then we also have coronary artery spasm, that is squeezing spasmodic movement of the coronary arteries. There are other risk factors that could cause angina pectoris, or that could predispose one to angina pectoris. First of all, we have physical exertion. When someone engages in very stressful exercise or extreme cold, that's extreme temperatures, like cold, too much feeling of cold can predispose and trigger angina pectoris. Then we also have extreme emotions. Somebody who is overjoyed, overwhelmed, or who is very, very, very sad, very, very, unhappy could trigger this. Another one is heavy workload. Someone who is predisposed to angina pectoris could develop it through heavy workload. Now, there are different types of angina pectoris. The first one we have is stable angina pectoris. Stable angina pectoris is a predictable type of angina pectoris, meaning that the person, the patient or the individual experiencing angina pectoris can actually recognize when it's about to happen. And normally, this one doesn't last for a long time. And another good thing about it is that when the person relaxes, the chest pain reduces. Another thing is that it responds to a drug called nitroglycerin. The unstable angina pectoris is different, opposite of the stable, because it is unpredictable. Even at rest, there is no relief, and it increases in occurrences. Now, the third one is variant or presmental angina pectoris. This one occurs as a result of coronary artery spasm, and that coronary artery spasm causes this blood shortage to the heart muscle, and that's where we have variant angina. The fourth one is intractable. This type of angina pectoris is chronic, is very incapacitating. It comes with a sharp pain. Even with rest, it does not relieve, and it's something that it's an emergency that needs to be taken. A kind of proper intervention needs to be taken immediately. Then we have the silent angina. In this case, ECG reading shows that there is angina pectoris. However, the person does not experience the symptom. There is no pain. But ECG reading shows that there is angina pectoris. So for easy memorization, we can just form an acronym that says SOVIS. So we have stable, unstable, variant, intractable, and silent. Alright, let's look at the symptoms of angina pectoris. First of all, we have pain. There is chest pain that radiates to the arms, to the jaws, to the shoulders. It radiates towards different parts of the upper region. Another one is dyspnea. The person has difficulty in breathing. There is pallor, there's dizziness, and there's palpitation. That the person feels his heart beating even when he's not supposed to feel it. Now, diagnosis. How do we recognize this? First of all, through the patient complaints, the patient history, we can recognize that this person has angina pectoris using this PQRST format of question. P stands for position or place. You're asking the patient, what position of the body are you feeling the pain? Q, what is the quality of the pain? Is it stabbing or is it a dull type of pain? R, the radiation of the pain. Where does it radiate to? It radiates to the arms, to the shoulders and the likes. S, what's the severity of the pain? And T, at what time does the pain takes place? Now, another thing, ECG reading will show T wave inversion. Now, for understanding of normal ECG reading, you can check out this video on it. So, for angina pectoris, ECG reading shows T wave in an inverted format. Then there is also increased troponin levels, a signal that something is wrong with the cardiac muscle. Now, how do we manage this condition? Medical management shows that drugs, certain medications like nitroglycerin can take care of this. For example, nitroglycerin is a vasodilator. It dilates the blood vessels and permits flow of blood to the heart muscle. Then we also have beta-adrenergic blockers like atenolol, propranolol. The function of this in this condition is to reduce the oxygen consumption by the heart muscles, thereby preventing or subsidizing the pain or reducing the pain. So another one is antiplatelets. For example, if there's a clot, antiplatelets like aspirin, clopidogrel, these drugs will dissolve the clot. And finally, we have analgesic. And majorly morphine is a preferred opioid analgesic of use. Nursing management, the first one is assessment. You have to assess the patient for pain, you have to assess the vital signs, you have to assess the physical condition of the patient. Then after that, we administer oxygen at a rate of, at a volume of 2 to 4 liters of oxygen. Then also you place the patient on semi-fowler position, meaning that the patient is placed on a semi-sitting position with the knees flexed. And we give health education. Health education on what? To tell the patient, please avoid smoking, avoid stressful activities, and when you feel this chest pain, try and get some rest. Don't stress yourself. Try to take your medications. Walk around with your nitroglycerin in case of emergency conditions. With this, we've come to the end of this topic for today. I'd like you to subscribe to the channel if you've not done so for subsequent videos. Thank you for listening.